My name is Aaron Liaw. I am a urologist who works in Detroit, Michigan for Wayne State University. I see a broad range of conditions, but including sexual dysfunction, children, adolescents and adults with reconstructive or urologic needs. I think it's important to understand that this is a very sensitive topic. Our penile size and function is very intertwined with our sexual function and self-image, and this affects both genders because it has such an impact on relationships. However, the definition there's no universal accepted definition of a micropenis, but the one that we use mostly in clinical practice is something that's 2.5 standard deviations below normal. Most men fall in a normal range, it's a bell curve, and for practical purposes, we would consider someone who has a stretched penile length of less than about 3 inches to have a true micropenis. And as you can imagine, that's not very common. This is a stretched length where you grab the end of the penis and pull it out, and an average man's going to be considerably more than that. It's also important to differentiate a micropenis from a buried or trapped penis. Scarring or fat can hide it, and even though the penis is normal size, it may look small. So in general, most men don't have a micropenis. It's a rare condition, affects about less than 1% of men worldwide, and the average man can rest assured that he's normal. About 1 in 10,000 newborns are going to be born with what we consider a micropenis. The penile size varies with the child's age quite a bit up to puberty. After puberty, there's a significant increase in penile size. For practical purposes, we would generally consider a boy who's prepubertal, who has a stretched length of less than about 2 centimeters, to have a micropenis. And it's important that we catch these before puberty, because in general, if you're born with something like that, it is going to be due to some sort of hormonal condition or imbalance. And these are correctable if you can get to them early, before puberty. After puberty, not only is it harder to correct, but you may not have full normal adult development if you don't correct it early. Well, the answer to that very much depends on whether you're a prepubertal boy or an adult. If you are prepubertal, like I said, it's normally a hormonal condition. You can correct these. You can give them the appropriate treatments that will restore normal function. Even if you don't have a easily defined or specific diagnosis, in general, most boys who are underdeveloped will respond to testosterone, and they will achieve a penile size within the normal range. After puberty is done, however, options are much more limited. I think we can all agree that if we had some sort of procedure or treatment that reliably increased penile size significantly, the landscape of medicine and sexual culture would be very different, but we don't. I mean, that doesn't really exist, right? There are cosmetic procedures that people would try, such as fillers and injections and implants. These generally have limited effect and also can cause scarring, which will actually make the problem worse through contraction or hiding the penis more. The surgical procedures that we use to increase penile size, most of them are just sleight of hand. You're just moving some skin around to make the penis look bigger without actually increasing size. There are a few procedures that do increase penile size, but these are extremely complex. There's only a few people around the world who will offer them, and there's a lot of complications that go with them. Even if they do succeed, the average increase in size is modest. It's usually about 1 to 3 centimeters or maybe an inch at most, right? And if you have a true micropenis, I don't think that's going to be a meaningful or significant increase in size. So unfortunately, no, there really aren't good treatments for adults with a micropenis condition. What we would focus on much more is treating self-image and focusing on sexual function as a whole rather than just focused on penile size.